Welcome to my channel Exploring Mathemedica. If you like the channel, please subscribe and don't forget to hit the bell so that you will receive further videos. My dear friends, here I would like to discuss with you one case of corn which gave me little trouble. Many of the corns I have treated with antimonium crudum, sulfur, natramur and so many other remedies. But here I am presenting to you one case where I got a different remedy because of this peculiar singular characteristic feature that this case was having. On 22nd January 2022, a male patient aged 24 years came with the complaints of corns in the right foot, and this complaint he had from the last 1 month. And this corn was aggravated by touch, by pressure. He is also having pimples from the last 2 years, and these pimples get aggravated by eating egg, chicken, and he also is having sneezing, which is a long-standing complaint to him, and he gets aggravated by dust. When I went to his personal history, his appetite is very much increased, thirst is increased, he desires sweets, chicken, egg and pickles, and for working and all he likes summer weather a lot. So what is a corn? A corn is a kind of callus which is made of dead skin. My dear friends, this person who came to me, who is age 24 years, 6 months back his younger brother came. He also had similar complaints of corn. So in the family, his younger brother had corns and he got treated by antimonium crudum. So a few doses of antimonium crudum eradicated the corns of his younger brother, and now he is the elder brother who has come to me with these corns. Here you can see in the image the two corns. He is having multiple corns, but these two corns I have taken the photograph because they are visible by photography. There are other corns which I will show when the healing process starts, but here only two corns you can see. And on that day, on 22nd, I gave him antimonium crudum 30, thinking that as his brother has also got all right and he is having little similar symptoms, so I gave him antimonium crud 30. And he came back to me on 3rd February 2022. This time, after giving antim crude, he has developed burning in the epigastrium since the first prescription. You might have studied antimonium crudum in Kent's Mathemedica. In Kent's Mathemedica, you find that antimonium crudum, the main seat of action is stomach. Whatever may be the problem with the patient, his stomach is affected. And in this patient, the antimonium crudum has developed burning in the epigastrium, but his symptoms of the corn, they remain the same. So as he had desire for sweet, aggravation in the summer, this time I changed the prescription to sulfur. I gave him sulfur 200 on February 3rd, and he came back on February 14th complaining that now he is having a sensation of heat. Earlier he developed the symptoms of antim crude. Now the same person, after giving sulfur, developed the sensation of heat which we usually find in sulfur. So I thought I should continue sulfur, but not to aggravate him, I gave him sulfur in 50 millisiemental potency, that is 0/1, and he came further on March 9th. So when he came on March 9th, his complaints remained the same, the sensation of heat remained the same, for which he said he used to take a lot of coconut water, because of which he used to feel better. So this patient did not feel better with antim crude or sulfur, and this time what happened, on 19th March he came along with his uncle. So all these days he used to come alone and he used to give his symptoms I used to take. When he came along with his uncle said that he is having one major problem because of which the family members are affected. That is, he is having the habit of frequently washing his hands. And this frequent washing of hands has, people have seen more than 10 years in this boy. I asked why he does so, why he is washing his hands frequently. He said, मेरे हाथ में धूल रह जाता है sir. Even after washing the hands, the dust in my hand remains. So I will I am not satisfied with washing hand once. I wash my hands again and again. So this is an obsessive compulsive thing which he is having and which we find in one remedy. If I suppose by now you have got the remedy is syphilinum. So this particular symptom which is there in this person from last more than 9 years, that is of washing his hands, I gave him syphilinum 200 this time. So I gave him syphilinum on 19th March 2022. Just after 13 days he came back, and you can see in the photograph, and this time he said that the pain of the corns has completely reduced, and you can see that one of the corn has become black in color and the pain has reduced, and the third corn you can see in the first image, which has also become black, and this was not there in the earlier picture because it was not noticeable by the camera, so I had not put this picture. And another corn he was having on the toe, the big toe, that also has become black in color. So this improvement has happened just within a span of 13-14 days after giving syphilinum 200 only one dose. So this is on April 3rd April I took this photograph, and later he did not come to me. So I was desperate in knowing what happened to him, and I called him on 23rd April, and he said he is very, very fine, and I asked him to send the photograph of his corns, of his leg. He sent me the photograph. You can see the photograph here, that the corn has disappeared and the skin is now peeling. The dead skin is now coming out. You can see the peeling skin in this particular photograph on 23rd April. And further, another after 2 days, again he sent the photos. You can see that the corn has totally disappeared. So my dear friends, here the symptom that which is very, very peculiar in nature to syphilinum, where he wants to wash his hands frequently, there is a sort of obsession, and he feels that his hands are not clean. So that is what we find more troublesome to this patient rather than the corns. Coming to aphorism 153. In aphorism 153, Hanuman says that in this search of homeopathic specific remedy, here Hanuman, when he says homeopathic specific remedy, it is not a specific remedy for a particular condition or for a particular disease. He says this as a specific remedy for an individual. So this remedy is specific to that individual, not to a disease. So in the individual, if you can find a more striking, singular, uncommon, peculiar symptom of the case of disease, are chiefly and most solely to be kept in view. So what you should keep in mind is the striking, singular, uncommon and peculiar symptom of the individual, and if this symptom is also there in the remedy, that remedy will treat such a case. So this case, little bit it troubled me, but syphilinum did the work in this case, and the reflection of this case we can find in aphorism 153. So hope, my dear friends, you like the video. If you like the video, please subscribe. Don't forget to hit the bell. Thank you once again.